Today, we're digging into a landmark study that finally puts a real number on the connection between clinical depression and mortality. And we're not just talking about mental health impacts. We're looking at the hard data on how a diagnosis can actually affect a person's lifespan.
So, this is really the core question, right? We all know depression is a serious condition, but this analysis was designed to give us a precise, data-driven answer to just how serious it is when we talk about the risk of death. And the answer comes from this, a massive meta-analysis published in World Psychiatry. Now, remember, this isn't just a single study. It's a review of the best evidence we have from all over the world, which gives its conclusions some serious weight. So let's get into it.
Okay, here's our roadmap. We'll start by looking at the incredible scope of this research. Then, we'll get right into the stark numbers that quantify the mortality risk. After that, we'll identify who is most vulnerable, explore the positive impact of treatment, and wrap up with the key clinical takeaways. First things first, let's just take a moment to appreciate the scale of this meta-analysis. Because, understanding the breadth of the data is absolutely key to trusting the findings. The sheer rigor here is what's so impressive. The analysis pulled together 268 different studies, covering more than 10 million patients with depression. And here's the critical part. It only included cases that were diagnosed by a clinician using official criteria like the ICD or DSM. This is so important because it weeds out the bias of self-reported symptoms and really represents the highest standard of evidence. All right, with that foundation set, let's move on to the core results. This is where that connection between depression and mortality becomes really, really clear. So here it is, the headline finding. An individual with clinical depression is 2.1 times more likely to die from any cause compared to someone without depression. Let me just say that again. The diagnosis more than doubles the risk of premature death. But the risk gets even more dramatic when we look at specific causes of death. For those with depression, the risk of suicide is nearly 10 times higher, 9.89 times to be exact. This is by far the single largest risk increase that the study found. This chart does a brilliant job of showing the wider impact. Right at the top, you can see that staggering 9.89 times risk for suicide. But look further down the chart. The risk of dying from other unnatural causes more than doubled. And crucially, the risk from natural causes is also way up. Notice respiratory diseases are 2.34 times higher, and neurological diseases are at 2.28. Even the risk from cardiovascular disease and cancer is significantly elevated. This really drives home the point that depression affects the entire body. So we know the overall risk is clear, but the study actually goes a lot deeper. It identifies specific factors that can make that risk even higher. Let's take a look at who is most vulnerable. Timing, it turns out, is a critical factor. The data reveals this incredibly high-risk period in the first 180 days, right after a diagnosis. In that 6-month window, the mortality risk skyrockets to 10.8 times the norm. I mean, that's just a massive number. It really highlights an urgent need for intensive monitoring and intervention right from the get-go. And of course, not all depression is the same. The analysis confirms that the more severe subtypes carry a greater risk. For instance, patients with psychotic depression have a 1.61 times higher mortality risk than those with non-psychotic depression. And for people with treatment-resistant depression, the risk of dying from any cause is 27% higher. Now, this is a really crucial point. Depression is an independent risk factor. You might wonder if people with depression are just sicker in general. Well, even when you compare people with the exact same physical illness, say diabetes or heart disease, the person who also has depression still has a 29% higher risk of death. Look at the chart for alcohol and substance use disorders. When depression is also present, the mortality risk jumps by 2.59 times. It's clear that depression worsens outcomes across the board. Okay, so after looking at the problem in such detail, the study offers a really powerful message of hope by actually quantifying the life-saving impact of medical treatment. So this leads us to the most important question of all, right? Can we actually do something about this? And the data from this huge meta-analysis provides a very clear and very hopeful answer. Yes. The data shows that using antidepressant medication can reduce the all-cause mortality risk by 21% for people with depression. That is a significant protective effect demonstrated directly by the evidence. And for more severe cases, the effect is even stronger. electroconvulsive therapy, or ECT, reduces the all-cause mortality risk by 27%. This really underscores its role as a critical, life-saving intervention.
Let's just break down that protective effect of ECT a little further. Not only does it reduce overall mortality by 27%, but it also brings down the risk of death from natural causes by 24%, and most critically, it cuts the suicide risk by a third. These are not small numbers. These numbers represent lives being saved.
So, what does this all mean in practice? Well, the study concludes by translating all these findings into a clear, actionable strategy for healthcare providers and for health systems as a whole.
Here's the 4-point action plan that comes directly from the data. Number 1, intervene early, with intensive monitoring focused on that critical first 180-day window. 2, optimize treatment by identifying those severe subtypes and using proven interventions. 3, integrate medical care, managing both the physical and mental health of patients together. And 4, use precision prevention, developing specific strategies for the highest risk age groups.
The study's authors really summarize it best themselves. They say their results affirm the risk, they identify the most vulnerable patients, and they highlight the life-saving effects of treatment. That's a perfect summary of everything we've just walked through. So the crucial take-home message is this: the data is stark. It confirms that clinical depression is a systemic illness with severe mortality risks that go way beyond suicide. But the data also provides a very clear message of hope. These risks are quantifiable, the high-risk groups are identifiable, and we have effective treatments that are proven to significantly reduce mortality. They're available and they work. The challenge now is to put this knowledge into practice everywhere.